Good morning, everyone. Welcome to Munson Healthcare's COVID-19 press conference. Today is Tuesday, February 1st, 2022. My name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. Joining us today as speakers will be Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare. Dr. Nefsey will walk us through the latest COVID-19 hospitalization numbers and what we're seeing at Munson Healthcare. And then today we're going to do something a little bit different. We talk about COVID-19 prevention, everything you can do from vaccinations to masking and infection prevention measures. And today we're going to change the conversation a little bit and focus more on COVID-19 recovery. Brianna Worthington is going to share her story of her experience with contracting COVID-19, what her symptoms were, and what her recovery looked like. And then joining us also will be Bonnie Kruska, who's the Vice President and Chief Nursing Officer of Ambulatory Services for Munson Healthcare. Bonnie's going to share some stories of some of our COVID-19 support groups. And then also we're happy to have Josh Thorington, who's the Program Manager of Mary Free Bed at Munson Healthcare, to share Mary Free Bed's COVID recovery program as well. So we're going to share some different options and some new information that we have not previously shared at press conferences lately. There will be a Q&A session at the end of our panelist presentations today. So if you are a reporter joining us on Zoom, please submit your questions and we'll get to as many as we can at the end of today's session. And if you're joining us live on Facebook, we're happy to have you with us today. Please submit your questions via Facebook. And again, we'll answer as many as possible in our 45-minute time period. So without further ado, I would like to welcome back Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefsey.
Thanks, Diane. Appreciate being here. So let's go back into the numbers right away. We do have some good news with our percent positivity going down just a hair. I think it's important to note, and we'll look at this later, that the numbers are still quite high, but we are trending in the right direction. So if you look at the state of Michigan, they're at a 28.8% positivity rate. That is a decline from the previous numbers, although their cases per 100,000 did go up. If you'll go to the next slide. Our regional percent positivity is 27.6%, which is the same, so holding steady there. And our cases per 100,000 are also slightly up. So hard to really interpret what that means over the weekend, but we will continue to watch and let you know. Next slide. So there you can see, this is sort of what I was alluding to, you know, that we have that last surge there. And even though our numbers are kind of holding steady, you can see they are really at the same level or above what we were with the first two surges. So we are seeing a bit of a decline in our number of cases, although it is still quite high. Next slide. There you can see, so we have 83 hospitalized patients. That is down a bit from last week, but about steady from where we were in the previous weeks. We are seeing an increase as we see our percent positivity quite high with the number of vaccinated people who are being hospitalized for COVID. However, you'll see that those boosted numbers are still quite low, and there's still a majority of unvaccinated people hospitalized. And I think where you really see the difference there is in our ICU numbers and our number of patients on ventilators. So you can see few of those ICU patients are vaccinated, none of them are boosted, and none of the patients that we have on ventilators likewise are vaccinated or boosted. So again, can't stress enough the importance of being vaccinated and then also getting your booster when you are eligible. Next slide. This is a slide that just reiterates that point. I think you can see that black line there is the number of deaths in people unvaccinated, and the two blue lines at the very bottom there are fully vaccinated and then fully vaccinated and up to date, so basically having a booster. So again, a lot of protection against mortality with a vaccine and then again with a booster. So just making that point once again. Next slide. We continue to monitor the flu. So low cases there. We are seeing some flu activity, but again, not as bad as we've seen in past years, and certainly helpful as we continue to navigate this pandemic.
Thanks, Dr. Nefsey. Appreciate that update. Glad to see that numbers are beginning to trend down, but sounds like we're holding steady there. So thank you again for that update. We'll have you back for the Q&A session after the rest of the speakers present. Next, it's my pleasure to welcome Brianna Worthington to share her COVID-19 story with us. So we're going to ask Brianna to turn on her camera and her audio. Welcome, Brianna.
Hi, Diane.
Thanks for joining us today. Brianna's story was recently featured on the Munson Healthcare blog, and we've also been sharing it throughout social media because it's, I think it's a great example of an unexpected COVID-19 story, but one that I think is more common than we think. So first, Brianna, if you could just tell us a little bit about your background and who you are and sort of what your life was like, what you like to do and how active you were and sort of your state of health before you contracted COVID-19.
Yeah, thanks, Diane. Happy to be here. So, yep, my name is Brianna. I'm from Traverse City. I'm 25 years old. And before contracting the virus, I really enjoyed a lot of things that we as Northern Michiganders like to do. I love to hike and run and take fitness classes and all of that kind of stuff. And so, yeah, I would consider myself, I was pretty active before getting sick.
And Brianna, did you get vaccinated? Did you choose to get vaccinated? And were you following, infection prevention precautions?
Yes, I am very grateful for my decision to get vaccinated. So my immune system really had that base level prepared to fight the virus when I got it.
So when did you contract COVID-19?
I tested positive in the fall, and shortly after that, I began to get really sick. I experienced the things that we all have heard about, the shortness of breath, the weakness, and I think that component was quite surprising for me, just how much that it physically affected me. I went from being able to run and hike and do all of these things that I love to do to struggling to walk to my mailbox and back without having to take a break to catch my breath. So I'm really grateful that I decided to get vaccinated before I got sick, because I truly believe it could have been so much worse.
So Brianna, I too had COVID-19. That was back in 2020. And what I experienced, I would call worse than any flu that I've ever had in my life. So, I'm sure you've had the flu in the past. How would you compare your symptoms that you experienced to other colds or, respiratory diseases you've had in the past?
Yeah, so my experience with COVID-19 was, that was the most sick I've ever been in my entire life. The flu, I've had that before, and it just didn't touch what I experienced with this breakthrough infection.
And how long did it take you to fully recover? And are you fully recovered now, do you think?
Yes, I am fully recovered now. It took me months before I really started to feel like myself again, before I could walk up and down stairs and down the road. That was a big milestone for me. But now I'm back to running, and I'm learning how to climb and doing all the things that I really love to do. And for that, I'm very grateful.
Well, I'm glad you're feeling better, and I'm glad you're feeling like you're fully recovered again. What would you like other people who are active and healthy and within your age group to take away from your story?
COVID-19 doesn't care if you're young or old, or if you're healthy or not healthy. It can really affect people in different ways. So I encourage everyone to do whatever you can to prevent from getting sick, because what I experienced was quite surprising to me. And when I share what happened and how I felt, even this emotional component of being so sick, feeling really frustrated with my body and afraid that I would feel like that forever, I wouldn't want anyone to ever go through something like that. So I really encourage you to do whatever you can to prevent yourself from getting sick and protect yourself and your loved ones from getting that sick. And luckily, I had decided to get vaccinated, and I didn't get as sick as so many of the people are getting now. And the case that I had was very mild compared to what we're seeing in our hospitals and our communities.
Well, Brianna, thank you so much for sharing your story. We really appreciate it. And I think it makes us all think about, our own personal health. And these are all personal decisions, but just knowing and seeing the numbers that Dr. Nefsi reported on with the people who were vaccinated and are hospitalized, and just hearing your story. We're glad you weren't hospitalized. We're glad you're feeling better. And again, thank you so much for sharing your story. And if you don't mind, we'll have you back in a little bit for some questions from the audience, if that's okay.
All right, thanks, Diane.
Great, thanks, Brianna. All right, our next speaker today, we're welcoming back Bonnie Kruska, who is the Vice President and Chief Nursing Officer for Ambulatory Services for Munson Healthcare. And if you recall, Bonnie has been with us in the past to talk about vaccination clinics and treatment options. Bonnie, it's always great to have you on this, and looking forward to hearing what you have to share with us today related to COVID-19 support groups. And I believe you're also going to be discussing more details on monoclonal antibody therapies. So welcome back.
Thank you, Diane. Thanks for having me today. If you want to go to the next slide, thank you. So most people recover from COVID-19 within about 2 weeks, but a smaller group of survivors, much like Brianna, experience prolonged health-related issues, sometimes lasting months. I even heard of a couple folks experiencing symptoms beyond a year. Long COVID is generally described as ongoing COVID-like symptoms greater than 4 weeks, and it can happen to anybody who's had COVID-19. Symptoms can be mild or severe, and there's no link between risk factors and long-term problems. Patients can experience a wide range of symptoms. I've heard fatigue, brain fog, shortness of breath, joint pain, depression. One that I learned of recently through the support groups is hair loss, chest pain, among other reported symptoms. These symptoms can be mild or debilitating and can be incredibly disruptive to a person's life. Next slide, please. The Munson Healthcare Support Group really is designed to support people like Brianna and those who don't fully recover from COVID. During the meetings, we have content experts that share the latest information and provide practical guidance for addressing the most common symptoms. Some previous topics have included healthy eating for a strong immune system and guided meditation for symptom management, for example. Sessions are held the first Thursday of each month. Pre-registration is required. The meetings take place via Zoom from 5 to 6:30 p.m. Participation is free, and we do have our next meeting scheduled for March 3rd. I think it's really important for people to know if they have symptoms of COVID-19 beyond 4 weeks, and it does interfere with their daily life, that you shouldn't hesitate to reach out to your primary care provider or seek help in a support group such as this. There are services available to help, and I really do look forward to an upcoming speaker here to talk about some of those services available to help symptom management. Next slide, please. All right, so now I'd like to shift topics to move to monoclonal antibody therapies so I can provide an update about Munson Healthcare's program. As you can see in this graph, it represents the number of monoclonal antibody treatments given to eligible patients with COVID-19 at all Munson Healthcare facilities since April. Munson has administered 3,368 treatments to date with this monoclonal antibody program. And as you can see, recently, there is a downward trend of treatments given. This is really due to the scarcity of the medications. We receive limited supply of monoclonal antibody treatments from the state, and the timing and quantity is very, very unpredictable. Next slide, please. Many of you are probably aware that sotrovimab is the only effective monoclonal antibody treatment against Omicron. So it is the exclusive agent that we use at Munson Healthcare to administer to qualifying patients. And presently, we are allocating what we call MAB treatment, monoclonal antibody. So MAB treatment to patients using a tiered system developed by MDHHS. So as a reminder to our community, referrals do exceed available appointments, as you can kind of see in this graph. I think in the last week in January, we had 83 referrals and we were only able to schedule 24 patients. Next slide, please. Munson Healthcare also offers pre-exposure prophylaxis for prevention of COVID-19 by using the monoclonal antibody Evusheld. It's indicated for, again, pre-exposure prophylaxis for immunocompromised individuals, 12 years of age and older, who are not expected to respond to COVID vaccination. Referred patients do have to meet a prioritization criteria, much like we use with sotrovimab. And so we look at this tiered system to identify those that are eligible to receive treatment. Treatment right now is offered on a regional basis in Grayling and Traverse City, and soon to be expanding in Manistee. And viewers can certainly learn more about Evusheld by logging on to munsonhealthcare.org. Lastly, I want to remind everyone that vaccination really is your best option against COVID-19 to avoid hospitalization and serious illness. Once hospitalized, our options, as you just heard, are very limited. We remain short as far as treatment options, against this Omicron variant. So if you are eligible for vaccination, we encourage you to get vaccinated. The number of eligible patients for MAB therapy, again, exceeds our current supply. So we really would like you to use this option as opposed to waiting and then seeking treatment. I'll give it back to you, Diane.
Great. Thank you so much, Bonnie. Appreciate that update. And we will have you back shortly for the Q&A session.
Great.
And last but not least, our last speaker today I'd like to introduce is Josh Thorington. He's joining us for the first time today. He is the program manager at Mary Free Bed at Munson Healthcare. Josh, welcome, and looking forward to hearing what our partners, Mary Free Bed, have to offer the community as far as COVID-19 recovery resources.
Yeah. Thank you for having me. And I know I speak on behalf of both organizations when I say we appreciate the opportunity to talk about options for patients who are suffering with symptoms due to long COVID or long haulers. A little bit of background, Mary Free Bed recognized at some point during the pandemic that patients were experiencing many challenges and prolonged hospitalizations and were left to fight these symptoms alone at home, and a lot of these symptoms lasted for weeks or months after the infection is cleared. And as a leader in rehab, we recognize an opportunity to help restore people's functional abilities and things they had lost due to COVID-19 with a rehab-based approach. And so we created programming around long COVID, led by board-certified physiatrists, using the most up-to-date COVID-19 research and treatments and what we're learning as we've provided this program to offer options to patients who are suffering with symptoms due to COVID-19. It is a multifaceted program, individualized to the patient. So we offer everything from a short round of physical therapy and group psychology to a more extensive rehabilitation approach. Next slide, please. One of the big things we noticed very early on is that a lot of previously healthy individuals who had not experienced any sort of healthcare or health issues in their life were suffering from issues due to COVID-19. And that brought a lot of emotional challenges, anxiety, depression, fear. And so recognized the immediate need for psychological services along with rehab, either physical therapy and or occupational therapy and speech and language pathology to address more of the physical impairment side. But the program starts with a referral to our physiatrist, Dr. Olenichik, who's going to do an individualized assessment of the patient and learn what type of impairments and limitations they're having. And he's going to manage, as a physiatrist, this health condition for the patient. And so he will order anything the patient needs, from therapies and psychology to any imaging that might be needed or respiratory therapy. Whatever the patient needs, he's going to order. The program also starts with a one-on-one session with one of our psychologists who is going to determine whether there's intensive care needed or if more of a group therapy session is appropriate for the patient. Typically, physical therapy is also ordered based on what we've learned over the last year to year and a half of providing the program. And we've seen a lot of patients with deconditioning and fatigue, persistent pain, and sleep issues that require a rehabilitation or a physical therapy or an occupational therapy approach. All of our sessions are individualized one-on-one care. We don't have specific treatment protocols. It's all tailored to what the individual patient in front of us needs and how they're presenting. As part of the partnership with Mary Freebed and Munson Healthcare, we have lots of options for physical therapy across northern Michigan, but we have psychology and the doctor are limited to one location at this time. So we do have a pretty intensive virtual platform or accessible virtual platform that allows us to reach the entire northern Michigan community through virtual care. Next slide, please. And COVID-19 is no different from any other injury. People are suffering from loss of function and emotional distress. And so the research is showing that the sooner that you're getting into the rehabilitation experts, the better your outcome is going to be. And so we are seeing this every day in our clinics. And so it just starts with a referral to our program.
Josh, thank you so much for that information. It sounds like a wonderful program. Munson, I can speak on behalf of Munson Healthcare. We're excited to be partnered with Mary Freebed to offer this initiative. So thanks for sharing those stories and that information. We're going to ask all of our panelists to rejoin us now, and we will begin our Q&A session. So we have plenty of time to answer all your questions. Please either submit them via the Zoom or ask them via Facebook, and we will get started. So the first question is for Dr. Nefsi. I'd like you to start first, and then others, please feel free to join in if you have additional comments. But the question is, do hospital or health department officials have an idea of what percentage of people who get sick end up developing long-term symptoms? And are certain populations more prone to developing long-term problems?
That's a great question. And like with everything, we're fairly early on it. So there have been quite a few studies, and anywhere from 10 to 30%, they think, of people who get COVID will develop a longer term, long haulers or longer term sequelae from having the disease. Certainly we know the sicker you are, so our patients that are in the ICUs and that kind of thing definitely tend to have a longer recovery period than people that have mild disease, but they're, outside of that, there's not really any rhyme or reason. But 10 to 30% is pretty significant. So quite a few patients. And I think it's important for people to understand that they don't have to suffer alone with those long-term sequelae. There is help out there to help you manage the problems that you may have.
Thanks, Dr. Nefsi. Bonnie, any additional comments?
No, just like Dr. Nefsi said, there's really no clear link between risk factors and whether or not you'll develop long COVID. So really, it's being studied presently. We continue to study it, and hopefully, we'll have more information on how to manage those symptoms very soon.
Thanks, Bonnie. Josh, any additional thoughts on that?
I would just reiterate what they've said. We haven't seen any pattern to it in our clinics yet. So,
and I think Brianna, you can probably speak to that as well. I don't think you probably anticipated that you would develop long COVID as well, right?
Right. Yeah, it was definitely a big surprise. So that's why I really I'm grateful for this opportunity to share my story, just to encourage people. Even if you don't have pre-existing conditions, this is something that can really affect you.
All right, thank you. The next question, again, I'll start with Dr. Nefsi. With so many people testing for the virus at home and not reporting positive cases, what do the state numbers mean right now? And as a follow-up, the question is, how are we tracking the severity of the pandemic locally?
It's a great question. We do know that, a lot of those home tests, regardless of positivity or negativity, are not being reported up through the health department. So there is, definitely a proportion of people that we don't have the numbers on. So I think it remains to be seen whether then the percent positivity is, underestimated or overestimated, because it's both the positive and the negative tests that aren't being reported. I think that we could generally say, extrapolate what we're seeing to kind of what's actually happening. So, we know that there's a lot of COVID going around right now, and it's higher than what we've seen in the past. Outside of that, it's really, it's hard to know how to interpret that data, but certainly we continue to do the best we can with the information that we have.
Thanks. And Dr. Nefsi, another question. It reads, a trend identified earlier saw Delta numbers decreasing as Omicron increased. Is this still the case? And are we still seeing Delta in the Munson Healthcare network?
Yeah, I'm sure we are. It's another good question. And I think we've said before on this press conference that the way that those the positive viral tests are sequenced, not all of them are. So we can't tell you with a surety that it's, 97.6% of those cases, positive cases, are Delta versus Omicron. What we know when we take a sampling of our positive tests and test them and sequence them, that we are seeing more of the Omicron variant versus the Delta, to the point where we have pulled, and the CDC has pulled, the Michigan Department of Health and Human Services has pulled, the use of and the emergency authorization of the monoclonal antibody that we know doesn't work against Omicron and only works against Delta. So I think it's safe to assume that the majority of the cases that we're seeing right now are from the Omicron variant.
Thanks, Dr. Nefsi. On a related note to monoclonal antibody therapy, I'll have Bonnie address this question. Can you clarify when people can receive monoclonal antibody therapy, and is this available if they are hospitalized?
That's a really great question. Certainly things change daily as it relates to COVID and the treatment of COVID. Presently, there are two types of monoclonal antibody treatment in the outpatient setting, as I outlined in the presentation. So there is a medication called Evusheld, which is a monoclonal antibody therapy, and that's for the prophylaxis, or some people say the prevention of getting COVID-19. And really that's geared towards folks who are not able to mount an immune response. And then we have monoclonal antibody therapy for treatment of COVID-19, which is the sotrovimab that I talked about. And that is generally used in the outpatient setting or long-term care setting. And it's really important that with that particular treatment, you have a timeline that treatment needs to occur. It's within 10 days of symptom onset. So it's really important criteria that folks have to meet in the outpatient setting. So presently, we do not offer therapies on an inpatient basis, other than remdesivir, and I'm not sure about the use because I'm not an inpatient content expert in kind of how we use that at Munson Healthcare, but maybe Dr. Nevsky can speak to that. And then we have two other options. We have Paxlovid and molnupiravir, and those are oral antiviral agents, and those are used also in the outpatient setting.
Thanks, Bonnie. Appreciate that. Dr. Nevsky, any further comments on that?
Yeah, I think it's important to know, and I think Bonnie alluded to this, the oral antivirals and the monoclonal antibody was really studied on the outpatient population. So we don't have good data. And the intent was not to use them on the inpatient side. We have other therapies. And I think, as people know, often prevention or early treatment of a lot of illnesses is much better than treating it after the fact, which, just to reiterate the whole vaccine piece.
Thank you both. Next question is for Josh. You mentioned people needing the psychological component and dealing with some challenges there. Do you think there's any correlation to the psychological need or challenges that people are facing and the fact that we did have a lot of people were staying at home and cocooning and self-isolating for long periods of time? Is there any sort of residual effect to that you're seeing?
Yeah, speaking with our psychologists, they're experts in this area. They said most definitely they've seen both psychological effects of having symptoms that they don't know how to deal with them and feeling hopeless, but also, yes, definitely the side of isolation and not having that interaction with humans. And there's a lot of fear goes both ways, fear to leave the house and fear of not knowing how to recover from this. And so, yes, definitely we're seeing both of those in the clinic.
And just to clarify, if Josh and Bonnie, you could just clarify one more time. So Josh, your program with Mary Free Bed does require a referral from a physician, correct?
Correct.
Okay, and your program does offer both physical, occupational therapy, along with some psychology involved if needed. And then Bonnie, the program at Munson Healthcare is free. You don't need a referral, correct?
That is correct.
So could some patients participate in both if they felt, that they needed that extra support?
Absolutely. And I think that's a great idea. And we certainly, during our support group, provide resources like the resource at Mary Free Bed to patients, just so they know that there are options out there to treat those physical manifestations of kind of the disease.
Great, and thank you. I will ask this next question to all of the panelists. I might just ask Josh to start commenting on it, because we mentioned some of the psychological components and some of the fear that's involved. This question is from one of our viewers on Facebook. How dangerous are things for people who have stayed home all this time, not been sick with anything since early 2020, and now want to get back out in the world and travel and things like that? Is it dangerous out there? Should they be afraid? Can you address that?
To stay in the rehab lane, in my lane, we talked about the emotional side. From a physical impairment side, most certainly not, losing physical activity and your normal daily routine can cause lots of deficits. And so I understand there's danger and fear of leaving the home and getting sick, but there also is danger of staying in the home and losing your routine and your strength. And we're seeing a lot of that deconditioning and fatigue from lack of activity as well.
Bonnie or Dr. Nevsky, any other additional comments on that?
I'll go first, and then I'll let Dr. Nevsky add to it. I think that we know much more now than we did at the outset of the pandemic, and we have strategies that we know of that are sound scientifically, that will help protect us and our families and our friends and our community around us. So as long as you implement those mitigation strategies, get your vaccination, wear an N95 mask if advised, social distance from one another, don't go in large crowds without masks. I think there's a lot of things that you can do to mitigate the risk of transmission of kind of the disease and keep yourself safe. But I too, like Josh, say that, there's also detrimental effects of just staying home and being isolated and not enjoying your kind of routine physical activities and getting out. Anything to add, Dr. Nefsi?
No, I think that's exactly right. I mean, certainly there are people that are higher risk, and it's going to be a lot, a different balance for them than it would be for somebody else. But it's just like driving a car, right? Nothing is risk-free. And there are steps you take. You understand the risk of driving to work every day. I drove into work today, but I made sure that my car had gas in it and that it's fixed, and I obeyed the speed limit, and I wore my seat belt, and I paid attention, and I did all of those things. I did everything I could to keep myself safe in that drive. That doesn't mean I completely eliminated my risk, but I reduced my risk as much as I could. And it's the same thing with this. If you are vaccinated and boosted, you wear your mask, you're smart about who you hang out with, and you don't take unnecessary risk. I think it's absolutely appropriate to be outside and do things like you can. Now, if you're not vaccinated or you're at high risk from a health perspective, your risk is a lot higher, and you need to take that into consideration as you figure out what the right balance is for you in your life.
Thank you all. That was very well said. Our next question is for Brianna. There is a viewer who would like to know, what type of treatment did you receive, and did you qualify for monoclonal antibody therapy?
Yeah, so for me, my treatment consisted of staying hydrated, making sure my electrolytes were back to where they needed to be. And I talked to my doctor about that therapy, the monoclonal antibody therapy, and I actually didn't qualify. So while my experience with COVID-19, that was the most sick I've ever been, it was still considered to be a mild case, which sort of that took me aback when I really fully realized that, because what we're facing as a community, this experience gave me a greater understanding of how, of what we're facing right now. So my treatment also involved going for short walks and just to get my stamina back up, get my muscles moving, get me outside again, which was good for my physical and emotional health. But so I finally was kind of getting back out there a little bit, just bit by bit, until I was strong enough to walk down the road and back without being out of breath. So no monoclonal antibodies.
Great, thank you, Brianna. Our next question is for Josh. Can you comment on the results you are seeing with the recovery program, and how long is the typical recovery?
Yeah, we're seeing lots and lots of positive results. I think if we had found ineffective results, we wouldn't have brought the programming up to Northern Michigan. And anecdotally, we don't know for sure how long. It's all individualized. So we've seen some people that have responded very quickly and only needed a couple sessions of therapy. And we've seen people that have been in care for 8 to 12 weeks recovering. And it all depends on, again, the individual and how they're presenting. Yeah, we do a lot of data collection. We're still in the phase of collecting the data. We haven't yet analyzed or synthesized the data to be able to really speak clearly to that, but we are working on it.
Thanks, Josh. And maybe we'll have you back in a little while when you have more data also to share, because it's, again, great work that you and Mary Freebet are doing. Brianna, one more question for you. Can you, we have a reporter asking this, can you please just reiterate when you first developed COVID?
Yeah, so I tested positive in the fall. It was late September, early October.
And have you reached out to any of these resources as a long hauler, or and would you use any of these services?
So I am very lucky. I had a fantastic support system. just to kind of help me through just talking about the physical and emotional impacts that this virus had on me. I had family members and friends checking in on me, very, very supportive coworkers. So I did not reach out to these resources, but if I were to go back, then absolutely I would. I think this would have been very helpful just to talk through what I was experiencing with people who are also experiencing it at the same time.
Thanks, Brianna. Dr. Nefsi, another question for you. Are we crusting in the pandemic, or is this just because people are not reporting the at-home test results?
I sure hope so.
I do too.
I think from what we're seeing nationally and across the state, it certainly looks like we've kind of peaked and are maybe heading in the right direction. We've had that hope before. So that sort of goes without saying that, certainly the possibility of, a different variant and those kinds of things could happen. But given what we're seeing, I am tentatively optimistic that we are heading in the right direction on this surge.
Right, thanks, Dr. Nefsi. We do have two follow-up questions. They're both related, but I believe we've already answered them. They're both related to, is there any rhyme or reason to who will develop long hauler symptoms? And I think each of you addressed that already, where there just isn't enough data yet to make any of those or draw any of those conclusions. So,
correct.
Okay. Let me see, Dr. Nefsi, it appears that Omicron reinfects people who become ill with prior variants. Is there evidence that first-time Omicron infection will block other variants? Or is reinfection just one of those things that could always happen?
Yeah, so there were a couple questions in there. I would say it's way too early to know what protection getting infected with Omicron will provide later. As this virus mutates, it kind of depends on the mutation. What we are seeing, though, certainly is people who were tested positive with an earlier variant certainly are susceptible to getting reinfected with Omicron. So certainly we are seeing, people who have like, gosh, I had COVID back in the fall, or I had COVID then, and now I've got it again. So not dissimilar to, what we're seeing with some of those breakthrough cases, even with vaccination. Some of it is a time thing, but some of it certainly is. This particular variant is much, much more contagious. We could estimate, given what we know about the response from a natural infection versus vaccine, that you probably have an even higher chance with having natural immunity from COVID than compared to the vaccine, that you would be more likely to be infected with Omicron. But again, we are, really still mid to late middle of this surge, and those studies are all ongoing, so hard to tell at this point.
Thanks, Dr. Nefsi. And we have time for one final question today, and I'm going to ask Bonnie to address this. And it really is a question that's kind of two separate but related topics. The question is, for people who see monoclonal antibody therapy or antiviral pills as an alternative to vaccination, is there a cost difference?
That's a really good question. So let me first talk about the difference between the oral antiviral and the monoclonal antibody treatment. The oral antiviral is offered free to those that have COVID-19 who meet certain criteria. But remember, just like the monoclonal antibody IV therapy and outpatient therapy, it is in limited supply, that oral antiviral. So just because you have the disease does not necessarily mean that you will fit the criteria in order to receive that medication. In addition, the monoclonal antibody therapy that we do on the outpatient basis for the treatment of COVID-19 is also funded through a program. So you will receive that for free, but there's an administration charge to that because you get an IV. So that's really important to know. as it relates to those medications or quote unquote treatments and the vaccine, as everyone I think is aware, the vaccine is also free, and you know, it's a one-time, you know, initial administration. It could be a 2-dose series and then a booster, but all of those are again covered through funding through the government. So if you look at the differences or the delta in kind of cost, certainly it's a much more economical way to avoid illness than be treated for the illness. That's kind of where I land.
Very well said, Bonnie. I think Dr. Nefsi would agree with you on that. I know I've heard Dr. Nefsi mention that in the past. So we are unfortunately out of time. I do want to get to just a few follow-up slides, but I first want to thank all of our panelists today. Dr. Nefsi, thanks for your updates as always. Brianna, thank you so much for sharing your personal story and for also sharing that on our blog and our social media channels. I'm glad to hear that you are feeling much better. Bonnie, it's always wonderful to have you back. We'll have you again back for an update, possibly on monoclonal antibody therapy. And Josh, thank you so much for your partnership with Munson Healthcare, and really hoping that you're seeing excellent results with those patients. Great services offered. So on a final note, we did talk a lot about testing today. If you are seeking testing resources throughout our region, there's many options available to you, either through our local health departments. You can check with your primary care provider, local retail pharmacies, and there are quite a few government websites and hotlines you can use. And then as always, you can call the Munson Healthcare Ask a Nurse hotline. Next slide, please. I again want to just make you aware that Brianna's full story and video is available at our munsonhealthcare.org blog. And I encourage you to read that. That was posted on January 17th of this year. So thanks again, Brianna. And finally, and as always, I encourage you to sign up for our bi-weekly newsletter where we share latest COVID-19 information and also just general updates on Munson Healthcare. Please follow us on social media. And again, the Ask a Nurse hotline is really just a wonderful resource in our community. That number is 231-935-0951. You can ask your COVID-19 questions or other general health questions. Thank you, as always, for joining us. Either want to thank our reporters for helping to share this information more publicly, and always thank you for joining us if you've been watching us live on social media. We will be back next week. We will have our local health department experts join us again for their updates. And until then, I hope you have a wonderful week. Stay safe and healthy.